everybody. My name is Liz Faust. I'm a nurse practitioner in wound ostomy and continence management. I work at Reading Hospital, which is a level 1 trauma center in West Reading, Pennsylvania. I'm here to talk to you about the prevention of readmissions and our protocol for chronic wounds with the use of Vash for a wound cleanser. So for those of you that don't know what Vash is, it's a very powerful antimicrobial preservative and a wound cleanser. Some of the things that I love about it is that its pH is 5.5, and so it's really optimal for wound healing, and it's non-cytotoxic. But the other really wonderful thing is that it can mechanically remove bacteria and debris, so that it's my little added insurance for trying to prevent infection and decrease the bacterial counts within the wounds, which we all know chronic wounds 100% have bacteria within the wound. And I would say, well, literature says 60 to 100%, but most experts agree that all chronic wounds have a level of biofilm. And so bacterial burden and the management of that is very important. Routine debridement is very important. And so mechanically removing debris could be a portion of that. So during this COVID crisis, I think we've ramped up our use of Vash because the patients aren't coming into the wound care center. So our wound care center has decreased the visits by a third to 50%, mostly because our skilled nursing facility patients don't have the opportunity to come out because of the need to self-quarantine. Our incarcerated patients have that same issue that they don't want to self-quarantine. So patients aren't coming to the wound care center as frequently that perhaps have other caregivers. The other thing is that Vash is part of our chronic wound care protocol anyway. So patients get the wound cleanser that they typically do with the dressing changes to help promote their wound healing. But it's also really nice because when we're doing televisits or if we're seeing any issues, we can instruct the patient, the family on how to utilize Vash as that wound cleanser, or even to do wet to dry dressings or wet to moist dressings with Vash as a way of treating, a mild bacteria, or if they think there's getting increased redness, we have the option of utilizing our chronic wound care protocol of Vash, like wet to dry dressings for a few days to see if we can decrease the bacterial burden on the wound. But routinely we use it before using advanced wound care products as well, just to help decrease that bacterial count and that added insurance for prevention of infection. Because I'll be honest, my patients may or may not have the best hygiene. Just saying, I really want them to have the least amount of bacteria on their wound as possible. So we've been able to easily instruct patients on how to use it. Since it's non-cytotoxic, if they are getting it on their intact skin or anywhere else, it's not an issue because it's not going to be harmful. And the other really wonderful thing is that we are able to guide the family on how to do it. So when we're trying to keep people out of our emergency rooms, out of our wound care clinics, decrease exposure, the use of Vash has been vital in helping us do that. So everybody stay safe, wash your hands, and keep your head above water during this time.